You know, I was given tremendous opportunities as a young girl. You know, my father was born and raised in Scranton, went to Penn State where he played football. You know, on Monday, the governor and I were in Scranton, and I said, and you know, my dad was a Nittany Lion, and Ed yelled, "Was Joe there?" And I said, "I think he was." And then decades later, my brother played for Joe. He was a member of the football team at Penn State as well. And every single year, my family would travel from the Chicago area where we lived back to northeastern Pennsylvania, but we would go by every small road and detour we could find, traveling all over this beautiful Commonwealth. And so I've been to Pittsburgh as a young girl and as a teenager, as a young woman, as an adult, and I've watched it change. I watched it go through some tough times, but then I have watched it come back roaring with a real sense of future possibilities awaiting. And what I believe is there isn't any reason why together we cannot take on every single challenge and come up with those solutions for America. I believe if we don't begin to come up with a plan to provide quality, affordable health care for everyone, our system will begin to deteriorate. Because look at what's happening now. 47 million people without health insurance. Millions more who have insurance except it doesn't pay for what your doctor says you need. Let me ask you, how many of you know somebody without health insurance? And how many of you, maybe you yourself, have had to argue with your insurance company to pay for what the doctor or the hospital said you needed? See, we've got two big problems. Here's how we can solve both of them. Number one, if you have health insurance and you're happy with it, nothing would change. But if you're uninsured or you're underinsured because you can't get the insurance company to cover you, we're going to open up the Congressional Health Plan to you. Congress has a good plan for itself. You know, this isn't socialized medicine or every member of Congress is already involved in it. I don't think that's true. This is not government run. These are private insurance plans, more than 250 of them, offered to federal employees. You choose among them. You choose what's best for you. You know, if you're a 25-year-old single person, you're not going to have the same health needs, and if you're a 45-year-old parent with 2 kids, right? So you choose among those different options. Now, taxpayers pay 75% of the cost of the federal government's health care plan. I figure if it's good enough for Congress, it's good enough for everybody else. And therefore, if we open it up, people will choose what they want, and we will provide healthcare tax credits, financial assistance, so that everybody can afford it, because everyone should be insured. Sometimes young people say to me, well, why should I be insured? Well, suppose you have a car accident. Or suppose, like many young people I know that I try to help as a senator, you wake up one day and you never thought it would happen and all of a sudden you've got cancer. Or you have some other diagnosis that's going to be very difficult. So it's important we get everybody insured, because every time someone without insurance goes to the hospital here, they do get taken care of, thank goodness. But then the cost is spread around all of us who have insurance. It's like a $900 hidden tax. So we want everybody covered. We also want to cover prevention, because it would be a lot better if we prevented you from getting sick instead of letting you get sick. And I believe strongly it is time to cover mental health. We can have mental health. put forth a plan. You can go to my website, HillaryClinton.com. It's all laid out there, how you would pay for it, where the money would come from, how we would save money, because I think we can save billions of dollars. If we had electronic medical records, we'd save $77 billion a year. Think of what we could do with that money to help people. But this is another one of those big differences, because you see, I do believe that as a Democrat, it is time, working with business and labor and doctors and nurses and hospitals, that we stand up against the insurance companies and finally get universal health care in America. Ask yourself, under our Constitution, isn't it illegal to discriminate against anyone on the basis of race or gender or religion or ethnic origin? Then why do we let insurance companies discriminate against you on the basis of your being sick and charge you so much and avoid taking care of you? You know, last time I was in Iraq a year ago, I saw a lot of people who were my age who had been called up, National Guard and reserves, in their 50s and 60s. Because we have been deploying over and over and over again, our active duty, our guard and reserve. Now these young men and women, and the older ones as well, do their service to our country, but they deserve our best efforts. It was outrageous. We had to fight to get them the body armor they needed, the armored vehicles they needed. You know, just in the last few months, I joined up with Congressman Altmaier to remedy an injustice that came to his attention through one of his constituents. I was outraged when I learned that the Pentagon was trying to take away the signing bonuses from wounded soldiers. And Congressman Altmaier in the House led the effort. I joined up with Senator Casey and a Republican senator, Senator Sessions, to change the law in the Senate, because I knew that it is against American values for us to go to the bedside of someone who has been wounded in service to our country and say, give back the money we gave you when you joined.